Over the past decade, we've seen a transformation in the world of cancer in terms of many novel drugs, new procedures that give patients a genuine chance of surviving long and maybe better with their cancer. The problem is, I don't think we've actually seen an equivalent concentration on basic nursing care with patients. There have been many surveys that have been conducted, not just in the UK, although there have been some important ones in the UK, but this is a worldwide problem, that the focus is always on treatment, new drugs, access to new drugs, and forgetting that patients still need to feel cared for. They need healthcare professionals who introduce themselves, who speak to them in a language that's understandable, not patronising. And they need nurses who will look after the fact that they perhaps are feeling hot, that they need their hair brushed, that they need their sheets straightening. None of these things take a lot of time or a lot of money, and yet they're things that are being severely neglected. I showed the results of a survey that was done of nearly 2,000 nurses in the UK, and almost a half of them said that they wouldn't want a friend or a relative to be cared for on a ward in their hospital. And that's absolutely shameful, especially when you think about the fact that more than half of them said that when they actually visited a friend or a relative in hospital, they themselves had had to perform basic nursing duties for their relative or loved one. And I think these sorts of things are shameful. If we really can't introduce ourselves to people, if we can't talk in a language that they understand about the rationale, the logic for these wonderful new treatments that they may sort of avail themselves of, then we've missed something. We've really missed something.